All right, so we're going to go over COVID-19, what we know so far, and planning for the future. There's been a lot of new information, and so my name is Dr. V, and emergency medicine physician. The documentation for this information is on AskDrV.us. And today is December 1st, and we are going to get going here. All right, presentation is going to be 10 to 15 minutes. Q&A will be 30 to 45 minutes. And any questions that you have, nothing is too simple, nothing is too complicated. It doesn't really matter. You may be trying to decide what to do for what happened over Thanksgiving, what you're going to do over Christmas, anything that you want to actually discuss. All right, during the presentation, everyone's in listen mode. You can ask questions with the chat icon or during the Q&A, under the Q&A. And you can type in those questions as the presentation is going, so you don't have to remember them, and I will take the written questions first. The intention is to keep everyone informed on COVID-19 science to help them and their families stay safe during the pandemic. And the outcome is that people will leave this webinar motivated to create or improve an action plan. And they'll be motivated to create or improve an action plan, possibly for their church or their school or their union or their business. All right, it took 99 days to reach 1 million cases, 43 days to reach 2 million cases, 28 days later was the 3rd million case, 2 weeks later was another 1 million cases, brought us to the 4th million case. Then we did 1 million cases in 17 days and another 1 million cases in 22 days, which brought us up to 6 million. We are now double that. I wanted to kind of show people and remind people this was a slide from the summertime. So this was right around June, July. So we are now doing 1 million cases in about 5 to 7 days. So, you know, whereas at the beginning, it took us 99 days to reach 1 million cases, we're now doing 1 million cases in 5 to 7 days. So I just wanted to illustrate just from a previous slide, you know, how things have really changed and how we really, really need to be vigilant. We've now doing almost 1 million cases, almost 1 million cases a week. This particular article was from November 9th. At that point, we were doing about 500,000 cases, a little bit over 500,000 cases in a week. Coronavirus has topped over 250,000 deaths. I think we're at about 260,000 deaths. We're expected to be probably by the time of the end of January, right around 400,000. New York City school system, they did shut down recently. They had an agreement with the teachers that if the test positivity rate got over 3%, which it did. And I just want to remind people, you know, the state areas in Wisconsin have a test positivity rate of 36%, and the schools are still open. So there's a very dramatic difference between how some states are handling this and how other states are handling this. We could get to the point where we top 200 cases daily. We have not gotten there yet. We have gotten, I think, as high as about 185,000 cases in one day. I didn't actually add the case totals per day because they're a little sloppy sort of over the Thanksgiving holiday. Some states were reporting and some states were not reporting, and testing centers were down. So we'll really know what's happening probably by next week. Millions of Americans are at risk for their utilities being shut off and evictions. You see the states there in red. There are no moratoriums that actually protect folks from utility shut off or from evictions. I've been monitoring this situation. So Southwest said that they were going to unblock the middle seat as of November 30th. So that was basically as of Monday. So starting today, Southwest Airlines should now be selling the middle seat. I think right now Delta is the only airline that is actually not selling the middle seat. Delta Airlines has made a commitment to keep that open until March. So that's important when you look at what airlines you want to fly if you decide to take a risk and fly. So let's talk about COVID-19 quickly. Highly, highly contagious. You will need to be exposed for 45 seconds to infect others. Of 100 people that are exposed to COVID-19, 60 to 80% of them will become positive. This is much different than the flu, where it's down around 30%. This basically was an article that came out afterwards that sort of said the same thing, that you can catch COVID-19 in under 1 minute. This actually specifically says 45 seconds. Now, we discussed that COVID-19 operates as both a droplet and an airborne disease. Droplets are large, and because they're large, they fall very, very close to the person from the person they originate from. If you think about droplets, it's Ebola, pertussis, mumps. Airborne are smaller particles, less than 5 microns, and they can actually go a lot further in the air. So think about like tuberculosis or measles. So this is just a demonstration of it. The red are droplets and the gray is airborne. And it shows you how the heavier molecules, the larger molecules, sort of fall to the ground faster, and the other ones sort of spread out longer. So COVID-19 operates like both of these, both the red and the gray. Now, we talked a little bit about, I wanted to show you this. It's very important if you're indoors at all that you actually open the windows. So this little video is going to show what happens with microdroplets.
こちら、くしゃみを高感度カメラで撮影した映像。キラキラと漂うのがマイクロ飛沫です。100分の1ミリ以下と小さく軽いため、漂い続けるのが特徴。
バナナボートとか乗ったら楽しいです。いや、絶対楽しい、ね。めちゃくちゃ楽しい。
大きな声で会話をした時にもマイクロ飛沫は発生します。
近くの人、その人が吸い込むことによって感染が広がる、そういったリスクが見えてきたものと思います。
そのリスクを防ぐために効果的と考えられているのが換気。窓を大きく開け空気の流れを作るとマイクロ飛沫は排出することができるのです。
All right. So, I tell people for this winter, you want to open up the windows and have the heat on. So obviously, if you're at home with the people that you normally quarantine with or you're isolating with, then it doesn't really matter. But if you do happen to have someone over to your home, or even if you're at a restaurant, or if you're at a hair salon, you want to make sure that the windows are open, the doors are open. You want to actually have some ventilation actually coming in. That's critical, critical, critical. All right, so how do you know if you or your family may have COVID? There's basically 3 types of tests. There's a PCR test, an antigen test, and then there's CAT scan findings. And this is basically how the diagnoses can be made. So the PCR test actually detects genetic material of the virus. It is most accurate 8 days after exposure, and it is what we call the gold standard. It can be inaccurate if you actually take it too early or if you take it too late. The antigen test is the rapid test. This actually detects proteins on the surface. This actually gives you what we call a false negative. So it's negative almost 30% of the time when the person actually does have COVID-19. I want to repeat that. It is negative almost 30% of the time when someone actually does have COVID. So I would not take a rapid test and then feel safe to go visit family members, okay? I think it's really, really important. Now, if the antigen test is positive, the answer is really true, but if it's not, if it's negative, you really probably need to take another one. Now, some people are negative and they have symptoms, and we really think that they have a COVID-19, and we diagnose it by CAT scan of their chest. And this actually shows the yellow arrows on the second row, actually shows a sort of white striping, and that's the scarring or fibrosis or inflammation that you can see. It's a pneumonia that usually then causes some inflammation and then later on causes some scarring. All right, so the clusters of symptoms. Flu-like symptoms. First of all, I want to make sure everybody knows the significant symptom is no symptoms. So really there's 7 clusters. So someone could be asymptomatic. and have COVID-19. So whether or not someone is sick or not is not a way to protect yourself. Someone can be completely asymptomatic. So clusters 1 is flu-like symptoms without a fever. Cluster 2 is flu-like symptoms with a fever. And cluster 3 is someone with gastrointestinal symptoms. They may actually feel like they have a stomach flu or something, or like maybe they ate something that wasn't really, that maybe was bad for them or something like that. So 1, 2, and 3 are symptoms clusters where you normally can take care of those at home. 4, 5, and 6 are associated with fatigue, confusion, and then cluster 6 has everything. Abdominal pain, respiratory symptoms, coughing, shortness of breath, chest pain, fatigue, confusion, a little bit of everything. So 4, 5, and 6 are the ones that actually normally have to be hospitalized, may wind up in the ICU, or may wind up dying as a result of COVID. All right, so let's talk about how it replicates in your body. So first of all, it has these little spike proteins on it, and the spike protein catches onto a receptor, and that is how the virus actually gets into the actual cell. Then once it's in the cell, then it replicates. It converts this genetic code into protein, and it replicates these proteins over and over again. It makes copies. And then once it makes a copy, it actually creates a new viral particle there, usually surrounded by fat. The gray is fat. And then it comes on out and it goes and infects another cell. So this is kind of how it replicates and goes from cell to cell in your body. Remdesivir, which is one of the medications that is given sometimes, is something that blocks the replication in the cell. All right, so if you just found out you have COVID-19, let's talk about what you would do. 1, you need to have a quarantine room. It's very important, and you should get these things ahead of time. A pulse ox, I'm going to show you what that looks like. That's the picture there to the right. It's about $30 on Amazon. The reason why it is important is it tells you how much oxygen is in your blood. One thing about COVID-19 is when you are short of breath, you don't feel short of breath. So unlike other diseases like asthma and other types of pneumonia, you kind of know when you're short of breath. With this disease, you don't. And that's why we have a lot of people who die suddenly at home by themselves. So you want to get that pulse ox. The thing that says SpO2, which is hemoglobin saturation, it's 97 on the photo there. As long as that's 95 or above, then you're doing well. If it starts dipping below 95, that's when you should call 911 and go to the emergency department. Zinc and vitamin D3, everyone should be taking now during this pandemic. Everyone should be taking zinc and vitamin D3. These are the dosages. You want to have access to a bathroom that's only going to be used by you. You want to have a cell phone. Have people leave food at a closed door. You want to make sure to open up your windows. And if you can, change your filters or get HEPA filters if possible. A study found that 80% of the COVID-19 patients were vitamin D deficient. So vitamin D and zinc are seen to be somewhat very important. So let's talk about a treatment plan. If your saturation is less than 95%, then supplemental oxygen, vitamin D, zinc, famotidine, which I'll talk about, dexamethasone or steroid, remdesivir in some cases, and then Generon is not the name of the medication, it's actually a name of an antibody cocktail. So let's talk about this. Famotidine is Pepsid AC. Pepsid AC blocks histamine release, so it decreases the inflammation, and it's been associated with lower hospital deaths and also lower combined deaths and intubation. You can buy that in the grocery store. Dexamethasone is a steroid. This as a steroid, this is actually a medication you get when you're in the hospital, but it's been shown to lower the 28-day death rate for patients that require oxygenation or ventilation. Remdesivir is very controversial. Some hospitals use it, some hospitals do not. It has not really been shown to make a difference in death rate, but in some patients it may get them off the ventilator a day or two earlier. Regeneron is the name of a company that has an antibody cocktail. Because it's an experimental drug, it actually doesn't have a name yet. So there are two antibodies in there, one from a human that has recovered from COVID-19, and the other antibody is from a mouse that was engineered to have a human-like immune system. And both of them bind to the main surface spike protein and uh, stop the virus from attaching to human cells. Eli Lilly also has an antibody cocktail. So you may hear about Regeneron antibody cocktail or Eli Lilly antibody cocktail. In fact, Eli Lilly actually applied for emergency FDA approval on November 10th. I talk about this a lot. Your antibodies actually after COVID-19 go down. So we do have somebody in Nevada who actually caught it twice. There are several cases in Asia of people who have caught it twice. In this particular patient's case, the second time he caught it was worse than the first. We've seen cases where they've reported that the second time was not as severe as the first. So I don't think there's any particular rhyme or reason. This is just a British study showing that the antibodies actually do go down over time. They found that after 3 months, there was a 26% decline in the antibody concentration. All right, so this is what everybody is talking right now about is vaccines, vaccines, vaccines. So let's talk about some of the things that are most important, which is how many doses are going to be needed? How effective is it? What are the side effects? What's the distribution? A lot of talk about cold storage and peer-reviewed data. So what we know so far, the Pfizer vaccine is 2 doses. It is 92% effective. The side effect is soreness and fatigue, and it requires cold storage in liquid nitrogen. It has not been, the peer-reviewed articles have not been published. This is just what we know from what they've sort of uncovered as far as their data is concerned. The FAA confirmed that they have done the first mass air shipment of the Pfizer vaccine from Belgium to the US. They put them at various distribution centers around the United States. Then there's Moderna. Moderna is also 2 doses, 95% effectiveness. Now, Moderna actually states that they had no one who became seriously ill from COVID-19. Side effects are muscle aches, severe fatigue, and fever. It requires cold storage, but not liquid nitrogen storage. So negative 20 degrees, basically like a freezer. Now, what's interesting about the Moderna vaccine is that it prevents people from getting sick, but you still actually can transmit the virus. So this is really, really important. So I believe there will be a role to play for masks even after people get vaccinated. Because as you remember, the people that are not vaccinated, children and pregnant women will not be vaccinated. Moderna has also applied for emergency authorization for use of its COVID-19 vaccine. Now, a lot of people have been asking these questions. Well, who's going to get it and how are they going to decide who's going to get it first, et cetera, et cetera. All right, so back in October, the National Academies actually developed a framework for equitable allocation of the COVID-19 vaccine. And they were looking for adoption of this by Health and Human Services, states, tribal localities, territories, et cetera, right? So let's go over a little bit about what this is. Phase 1A covers approximately 5% of the population. This will most likely be frontline healthcare workers who provide healthcare work in either like a healthcare facility or a long-term care residential facility or a nursing home of some sort. 1B is approximately 10% of the population, and it will include people who have a significantly higher risk for severe disease because of underlying conditions. So this would be people who have cancer, heart disease, respiratory diseases, asthma, etc. Phase 2 will be is approximately 30 to 35% of the population. And you're going to see this be more like frontline workers, teachers, school staff, childcare workers, things along that line. Phase 3 will be 40 to 45% of the population. This will be young adults, children, I'm sorry, not children, but young adults, also people who like maybe are at colleges, universities, people who work at exercise facilities, etc. And then phase 4 will be everyone else, right? So, they've already started talking about, who is the Center for Disease Control has been meeting. They are going to probably announce a decision tomorrow about who will actually be in the group that gets the vaccine first, which is the group that they call the 1A group. So 1A is a group that gets it first, then 1B, then 2, then 3, then 4, right? So you'll probably see an announcement tomorrow around that. So just to give you an idea of well, how many doses of this and how many people are we talking about, right? So when you talk about long-term care residents, people in nursing homes, you're talking about 3 million people that would need 6 million doses. When you talk about healthcare workers, you're talking about 20 million people that would need about 40 million doses. Essential workers, those folks who work in grocery stores and places that have had transportation, you're talking about 80 million people and a need for about 160 million doses. So with a 2-part vaccine, you're looking at about 206 million doses that need to go out for all the people just in those 3 categories. All right, so let's take a look at some of the critical dates and some of the things that occurred, because I want to actually go back. I've had a lot of questions about what happened with Australia and how the United States has actually, how did we not do as well as many other countries? So I just want to re-present some critical dates. January 12th, that was the date that China actually published the genetic sequence. January 15th was the first diagnosed case in the United States. January 28th was when the CDC announced a COVID-19 test. February 13th was when the CDC realized that the test did not work. February 29th is when we had the first US death from COVID-19. And March 13th was when the state of emergency and the first sort of countrywide lockdown actually occurred. Okay, now, when you actually go back, when we look at some of the data on hospitalizations and billing data, we actually see evidence of some coronavirus cases that look like they actually dated all the way back to December. So what we're seeing in December is higher admissions and higher billings for respiratory disease. More people having respiratory disease that was resistant to the normal treatment. All right, so let's talk about how other countries responded to COVID-19 and what was the difference. So I'm going to use Australia as an example because Dr. Fauci talked specifically about the fact that Australia has gone several days with 0 new cases. Melbourne has gone with almost a week of no new cases. So United States is 328 million. Australia's 26 million population. And this was basically what was happening as of mid-November. In the United States, we had 85,000 people hospitalized with COVID-19. Australia had 18 people hospitalized with COVID-19. We had 8,834 people in the ICU. Australia has 1 person in the ICU with COVID-19 in the entire country. And as I stated, the nation's capital, Melbourne, has had no new cases of COVID-19 since October 13th. So let's look at what they did. So 1, February 1st, Australia closed its borders to China. On the 13th, they closed its borders to all other countries. On March 22nd, Australia closed bars, clubs, cinemas, gyms, and churches, and they have been closed indefinitely since March 22nd. The end of March, they limited social gatherings to no more than 2 people. They did widespread testing. Their healthcare workers are regularly tested. Nursing home workers are regularly tested. Prisoners and prison workers are regularly tested. Any Australian citizen with even the mildest symptoms by the end of March was being tested. May, Australia started testing asymptomatic people. They actually recognized the importance of asymptomatic spread, and they started widely testing asymptomatic people. Now, there's a lot of different rules in Australia that come with, they have what they call public health care acts. And these acts actually guide some of the things that, like, you know, you cannot have more than 2 people in your company, or some of these various things. If you fail to comply with a public health care order, there's a fine of $5,500 to $11,000. If you fail to comply and you provide false or misleading information, there's a fine of $11,000 and 6 months in prison. Engaging in any conduct that would cause a serious public health risk, like opening up your church and having service anyhow, throwing a huge party, is $50,000 or a year in prison. So as you can see, they have a lot of public health care acts that actually, and they enforce these public health care acts, and they enforce these public health care orders when they determine that the public is in danger. All right, I had a couple questions about UV light. UV light can be dangerous to human tissue. It can also kill viruses and germs. So what UV light kills viruses but does not harm human tissue? And that is basically at 222 wavelength. And so I had a lot of questions about, well, what about UV light? Should I use UV light? That is basically in this Nature article what they've come up with. And then lastly, air purifiers. You want to get one that's ozone free. You want one that filters down to 0.1 microns if possible. 0.1 microns is hospital grade. I got a hospital grade air purifier for $60 or $70 on Amazon. You want to look at how noisy it is. Mine's a little bit noisier than I like, but you know, it still does the job. Some of them have a sleep mode. Some of them have an indicator that tells you when it needs a new filter. Some of them, the filter is more expensive than the air purifier. So you want to check and see before you buy it, how much are the filters. And then also, you know, how big is the room going to be that you're actually going to put this in? Are you looking to actually put this in a small or large room? All righty. There's been some evidence that there has been some mutations that have actually made coronavirus more contagious. I'm going to talk about this a little bit more on Thursday, but I just wanted to bring up this article to actually show you what we are finding out about it. So it is really, really important to continue what you're doing around staying at home and limiting your social interactions to things that are outdoors.